Fetal circulation and introduction to congenital heart diseases. Fetal circulation, salient features. Pulmonary vascular resistance is high due to non functional drugs, increased BP in right side of the heart. Why is the pulmonary vascular resistance high? Due to ductal arteriosus, ductal venosus, foramen ovale, umbilical vessels, two umbilical arteries plus one umbilical vein. These are the communications in a fetus. This is the diagram for circulation before birth. Starting from the placenta, umbilical cord contains umbilical artery and umbilical vein. Placenta, umbilical vein. Umbilical artery, deoxygenated blood is going to the fetus, and then coming from the fetus. Ductus venosus is low resistance bypass. Placenta provides oxygen and nutrition to umbilical vein, where partial pressure oxygen is 80%. Fetal porter veins, inferior vena cava, partial pressure oxygen is 70%. Right atrium, superior vena cava. Circulatory changes at birth. At birth, placenta is cut off. Closure of umbilical vessels, closure of ductus venosus. At birth, breathing is present. Decreased pulmonary vascular resistance, decreased right ventricular pressure, decreased right atrial pressure. Clamping of umbilical cord plus removal of low resistance placental circulation, increased systemic vascular resistance, increased aortic pressure, increased left ventricular pressure, increased left atrial pressure. So right pressures are decreasing due to breathing and left pressures are increasing. This will cause closure of ductus arteriosus and closure of foramen ovale. Outcome of fetal structure. Structure ductus venosus. Closure, it is functional soon after birth. Anatomical closure is 7 days. And the remnant is ligamentum venosum. Foramen ovale is soon after birth. It is functional and closes up to 3 months or up to 1 year of age. Remnant is fossa ovalis. Ductus arteriosus, functional 10 to 15 hours after birth. Anatomical closure is functional closure is 10 to 15 hours after birth, and anatomical closure is 10 to 21 days after birth. Remnant is ligamentum arteriosum. Congenital heart disease prevalence 6 to 8 per 1000 live births. Inheritance is multifactorial. Most common congenital heart disease is ventricular septal defect. Most common cyanotic congenital heart disease is tetralogy of Fallot, TOF. Association. Genetic and maternal. Genetic association syndrome, Down syndrome. Most common association is endocardial cushion defects, atrioventricular septal defects. Turner syndrome, bicuspid aortic wall defects, bicuspid aortic wall defect, and coarctation of aorta. Noonan syndrome, pulmonary stenosis and atrial septal defect, ASD. Maternal condition, overt diabetes defect, VSD most common, and transposition of great arteries most specific. Rubella, patent ductus arteriosus, pulmonary stenosis, and ventroseptal defect. Systemic lupus erythematosus, SLE, heart block due to anti-Ro, SSA, LA, SSP. DiGeorge syndrome, catch-22 microdeletion. DiGeorge syndrome is catch-22 microdeletion. Defects: tetralogy of Fallot, conotruncal defects. So, and then another syndrome is Williams syndrome due to microdeletion. You have supravalvular aortic stenosis and elfin phases. Holt-Oram syndrome, autosomal dominance, atrial septal defect, skeletal anomalies, for example, absent radius thumb. Alagille syndrome, pulmonary stenosis, triangular face, and cholestasis. Condition: teratogens, lithium, phenytoin, and alcohol. In maternal conditions, teratogens are lithium, phenytoin, and alcohol, and defects for lithium is abstinence anomaly. Phenytoin and alcohol is ventral septal defect. NEDA's criteria for congenital heart disease: diagnosis, presence of one major and two minor criteria. What are the major criteria? Systolic murmur more than equal to grade 3, any diastolic murmur, central cyanosis with no improvement on O2 inhalation, improvement, respiratory etiology, features of congestion, cardiac failure. Major criteria is systolic murmur more than equal to 3, any diastolic murmur, central cyanosis but no improvement on O2 inhalation. If there is improvement, then it is a respiratory etiology, and features of congestive cardiac failure. Minor criteria is systolic murmur less than grade 3, abnormal blood pressure, abnormal ECG, abnormal X-ray, abnormal S2. That is the minor criteria.